From largely unexplained and severe cases of hepatitis in kids to potentially the first COVID vaccine for young ones being approved, we have so much to discuss today with our KSAT Q&A guest. And now we want to welcome Dr. Tess Barton. She is the Pediatric Infectious Disease Specialist with UT Health San Antonio.
Yeah, Doctor, good to see you. Thanks for being here as always. Let's first start with this hepatitis topic. Today, UT Health did confirm that a child right here in San Antonio is being treated for serious liver disease. A lot to explain when it comes to this issue. But first, do we know what's causing these hepatitis cases in kids?
At the moment, we don't have definitive information about what the cause is. From what we know from the outbreaks in other countries that have kind of preceded us, that have been investigated, it does appear to likely be a virus. And most of the cases, for instance, in the UK, were related to a virus called Adenovirus 41, but not all the cases. So the definitive cause is still being determined, but it does look like it's likely going to be this adenovirus.
And what is an adenovirus? What kind of symptoms are we talking about here?
So adenovirus is actually an extremely common virus, but there are dozens of different strains of that. And so we see adenovirus is actually the cause of pink eye, it's the cause of many common colds, and it's a common cause of diarrhea in children. But what kind of illness you get sort of depends on which strain you get. So this adenovirus 41 is typically a diarrhea virus, and it can cause some liver inflammation, but historically it hasn't caused severe liver disease. It's not a new virus, it's a virus that's been around a while, and the question is that virus perhaps changing to cause more severe liver disease?
If I'm a parent, I'm wondering, okay, what can I do to protect my child? So if you could explain.
Sure. So, we have other viruses that cause hepatitis that we have vaccines for, like hepatitis A and hepatitis B, but we don't currently have a vaccine for adenoviruses that we use routinely. So really the way that we prevent adenovirus being transmitted is the way that we prevent all other viruses from being transmitted, which is good hand washing, washing your hands before you eat, washing your hands after you go to the bathroom, for parents, washing your hands before you prepare food and change diapers. Those are kind of the normal ways that we, attempt to prevent these types of viruses.
So it sounds like a big question that researchers want to answer is, okay, if this adenovirus has been around a long time, but now it's causing really severe symptoms in kids, why? So as we kind of wait for that answer, what do parents need to be looking at in terms of symptoms of this?
So I think that, probably the most important thing for parents and for pediatricians at this point is really to be on the lookout. So this type of illness usually will begin with kind of a gastroenteritis or a stomach bug, right? So like vomiting and diarrhea. And most of those stomach bugs from viruses will come and they will go within a few days. So if it's not going away, and most importantly, if a child begins to develop jaundice, which is a yellowing of it usually begins with the white of the eyeballs and then progresses to the rest of the skin, that's a sign that the liver is involved. And so most pediatricians' offices are able to do liver function testing where they can see, is your liver inflamed or not, as a screening test. And if it is inflamed, then that might be a reason to then go and try to investigate further to see if this is possibly one of these cases of hepatitis.
So basically gastrointestinal issues that don't go away, that's when parents should really say, okay, we got to go straight to the pediatrician.
That and jaundice.
Yes.
Most regular, stomach bugs, stomach flus don't cause jaundice. And so if you see jaundice, that needs to be investigated immediately.
Okay, now let's talk COVID. Moderna wants the FDA to approve its vaccine for kids under 6 years old. We know that the kids would have to be at least 6 months old to get it. What else can you tell us about this?
So the Moderna vaccine, it looks like the studies that were done show that it's reasonably effective. All the vaccines, both the Pfizer and the Moderna in these younger children are sort of less effective than what we've seen in older children and teenagers and adults. And it's a little bit difficult to assess that because many of the studies were done during these variant surges like the Omicron, where overall the effectiveness of the vaccines was a little bit lower. But I think most importantly, one of the things that of course everybody's been looking out for is vaccine safety, and the clinical trials show that this vaccine, like the Pfizer vaccine for the older children, appears to be safe. And so I think that this, nothing is perfect. It's not a perfect vaccine, but I think that all the things that we can possibly have in our toolbox to try to just prevent, reduce the amount of virus that's circulating in our community is all a piece that we can do. So parents who are very eager to get that, I think will be waiting with bated breath for the opportunity to vaccinate kids when they're concerned.
Yeah, and once that is available for these younger ones, what advice do you have, what message do you have for parents who are still weighing that option and saying, okay, maybe my child doesn't have some of these high risk factors that certainly kids who do, they especially need the vaccine. What's your message to those still considering this?
Sure. I mean, I think that every family should sort of look at their family situation. And, if a child has high risk conditions that might predispose them to more severe COVID disease, then obviously, parents should be considering that. But it's not just the child, right? So, children live in families and they interact with other family members. And so again, looking at kind of the entire family, we know that people who have impaired immune systems don't respond well to the vaccines. Older people don't respond as well to the vaccines, and so they can still, be vaccinated and potentially get infected. And so anything that we can do to kind of just reduce virus spread within a family is generally beneficial to that family. So for parents who are kind of on the fence and, wanting to see, I think that, every family is different, and look at your family and see if this looks like something that actually might be beneficial for you.
All right, Dr. Tess Barton, infectious disease specialist with UT Health San Antonio. Thank you so much for being with us today.
Thank you.
All right, always great to have you. We'll be right back.